Hello, everyone. So, at the opposite of Guy, my intro was not done with ChatGPT, but it was actually created in the absolutely wonderful restaurant of Chamonix with all the good smells of raclette and things like that. So the artificial intelligence will not be able to teach us that yet. So we have here, we have just heard Stanislas Guerini, who is the Minister of Public Transportation and Civil Service. And if I understand very well, we have to basically use all the best of the two of these sectors in order to talk about the system and the organization of this system. And we have all the participants here and Marc with us remotely. And I would say that Guy has basically left the most courageous for the end. So Corinne has talked about innovation organization in the same sentence. So before that, it was the source of frustration and sometimes even disappointment. But I would like for us today to make sure that it is the synonym of inspiration. So Lise, I would like to start with you, probably if you agree with that, and probably talk about the very first part that is related to challenges and the context. When we're talking about caring, treatments, and the word of innovation has been used a lot here when we're talking about care, prevention, things like that. So what does technological innovation represent for you, and how would you define it today? Well, yes, indeed, this is a very important question. We're talking a lot about it. It has been already mentioned many times, and it has been mentioned since yesterday a lot of times as well. I believe that today innovation has, first of all, correspond to a certain need, to a certain use, which is why we need to have this connection, very strong connection with the field, which is why we have this innovation in healthcare, with this will to structure all of the missions and all the road maps around the field. So today we understand that the innovation is very much perceived as the innovation at the service of the patient, as the service of the care system, and it is very much turned toward the therapeutics, so that to allow to the patients to get their care. And today we also see this turning point that was very much explained yesterday, especially by the Minister of Health. And it's a major vector of transformation. And I believe that even beyond that, it's much more just a fashion effect or a marketing vision or a political vision of the topic. It's a necessity. And I think that today we no longer have a choice but to use this absolutely incredible vector of transformation in order to move towards the much more customized, preventive, predictive medicine and healthcare, and to start this change with this vision of innovation that is focused on the therapeutics and its service to the patient, but also diagnosis, prediction, because today we already have this possibility to predict some diseases as early as possible, but also to serve the healthcare staff, because the quality of their life is also a very important element. Then the organization of care, the access to care, the attractiveness, all of these elements. So I think that at every step of the value chain is very important. And this holistic vision is what we have to have today. We have this medicine that is very precise. And today we're also much more talking about the holistic approach in order to include all of these innovation-related topics that will be obviously major for our healthcare system and for its sustainability and efficiency. Yes, thank you very much. You have talked about the fashion effects and marketing effects, and we have been talking about with Laurence about it before that. But we are not here to please ourselves of engineers throughout innovation, but we are doing the innovation in order to bring value and progress to patients and our healthcare system. So how today can we do concretely in order to move forward without going deeper and deeper into the medicine that favors some, and to ensure in-depth transformation of our healthcare system? Yes, of course, we're not here to please ourselves, and we have already said it. Our medicine today is the medicine that favors some. So we are this small group, and we actually know where to go because we're professionals here, and I think that this is a real challenge today. Now, we're also here not to please ourselves, and with that, I think that we have to really start acting for the transformation of our healthcare system, because we really love to have great concepts and to talk and things like that, but we have a problem at the implementation side. Just as Lise has said, innovation is, of course, the technological innovation, so I'm here representing the industrials, so I was thinking about talking about the technological innovation. Yes, but this is also innovation on the organizational side, and I also believe that yesterday our minister has already mentioned it. This is also something that we can call preventional innovation, I think. So this this is an important challenge, an important stake of our transformation, because the envelope will never be as big as we wish for it. So we would like to do some innovation, but we will not be able to do some things. So we have to break our silos in order to do this, because it's been 15 years since we started doing CHAM. And we have to start doing the transfers between different silos. And yesterday we have been able to see it. Without this, we won't be able to achieve this transformation. We also have known, recognized and accepted. So this is something that is very important for us, and I think that everyone understands this, because we have some supporters of this very important campaigns on TV. There are some others that would like to take their phone and call us, but I think that we all need a real thinking, a real reflection to make sure that we are certain that all of our citizens understands the challenges and the stakes. What is this and what are the costs? Because when we are industrials, we have this impression that we only talk about costs. But when we're citizens, none of the citizens knows what is the cost of the innovation. No one knows when they go to the hospitals. And yesterday, one of my collaborators was telling me, we really don't have an idea about the costs. So we have a very important gap here. And it's important for us to really do this important stretch in order to solve this problem. So very often we say that France is the land of innovation, and we're all very proud of this. We have a lot of companies, startups, and we're all proud of this. But we have this objective to have 50% of the objectives that will be out in the United States, This is a goal that has been fixed there. And this week they said that they were at 63% in 2023 in the United States. So France is no longer the land of innovation. So our next challenge is, how do we make sure that the innovation will be back in France, in Europe? Because I think that all of us, we have to work at the European level, but how can we make sure that we will be able to bring all the innovation to all of our citizens, so that everyone will be able to benefit from it? And these innovations will finally transform our healthcare system. And for that, we will probably later go back to all of this, but we have discussed a lot of the data, because we have a lot of different data. Well, first of all, we have the data that comes out of our different devices. This is the easy data, very clean data, but we also have all the other data, like the synthesis, the other data. So that's a little bit more complicated. So how can we save some time to the doctors? How can we change our culture? And this is the question of change management. Thank you, Laurence. Marc, I think that, well, it's very important to talk about the preventional innovation. I think that this is the field that you are working in. So probably you can tell us something about the prevention. Innovation must, first of all, be guided, must first of all be done with a certain follow-up. So for you, the industrials, what are the precautions and the conditions for success that are essential to any form of innovation, so that not to block, but to optimize our systems and make them advance in the right sense? So for me, the innovation is, first of all, an innovation in diagnosis, because without the diagnosis, nothing can happen in terms of treatment, in terms of care. So the diagnosis is like the very first important variable here, and all the treatments will follow this. So just to give you a couple of figures, the group Roche has 20% of their turnover that goes to 11-day for the pharma and 12% for the diagnosis. So we see that there is this very important investment into this flow of innovation, and the lever with the impact on the market. Just to give you a couple of figures in this sense as well. So for the healthcare system, the cost and the fees that are associated for the diagnosis are of 2%, and the decisions that are impacted by the diagnosis are of 70%. So if we calculate all of it, we see that the lever is of 35 in terms of efficiency in the market. So there is something here that is really very important in this field of the diagnosis, and not just the diagnosis in vitro that I'm representing here, but also the diagnosis in vivo that Laurence is representing here. And I really appreciate the comment of Lise, who said that this is the moment for the early diagnosis, because here we also have a lot of innovation in this particular field, in the preventive diagnosis, the predictive diagnosis, and all of this is the innovation that is related to the diagnosis. And today I think it's a little bit underestimated. But this is the very beginning of all the follow-up, of all the upcoming treatments, therapeutic treatments. I think that the context is basically explained. Marc GIGET, you are online with us. I actually wanted to hear you as well. Probably you can talk to us a little bit about this point as well, because we understand that the society has started talking about the US. Laurence has just talked about this. And the society basically denies everything that we qualify as something new. For example, in the US, 52% say that they no longer trust their doctors, and 50% of the population think that the new technologies will bring more problems than solutions. So my question is very easy. So why this mistrust, and what are the society criteria for accepting this innovation? Well, thank you very much. I think that there are some criteria that are very historical, like the fear of losing their job, of not understand, of becoming marginalized and things like that, being eliminated. But when we're talking about healthcare, there are many very strong points. So this is life. People are scared to be poisoned, but at the same time, the society has this very ambiguous attitude toward healthcare. There is always this dream of the ideal world that will change everything, but at the same time, we have this fear, the fear that we will be the guinea pigs here, and the errors are here, and the errors must exist as well, so someone will be contaminated and things like that. So for the society, they have this position as waiting for something that will improve their life and their health, but at the same time, there is this doubt and uncertainty about all of this. So now, going back to the technological innovation, well, for me, in our very first approach on the impact of the technology with innovation, I would say that the technology is here for approximately 20%. All the rest is the jobs, the economy, and so on. There is also sociology, regulations, legal aspects, and all the other aspects that are also here. So just to give you, 25 million researchers in the world are here, but 20%, a little bit plus, are working in healthcare. So you see what is the repetition of all of this, and this is what we see, the innovation in the society. We can see all these generations, 3G, 4G, 5G, 6G, 7G, whatever, the iPhone and things like that. And the society all the time needs some new technologies, but the mistrust and the worry that they have is that they're asking themselves whether this is really useful. And today, indeed, we witness this mistrust, especially this mistrust for all of those who are responsible of the technology, because that's quite logical, but also starting from the moment that we have some new technological possibilities within the societies, those who were specialists of the old technologies and processes will be questioned here. So, and they underestimate very often this introduction into the society, this technology, and this is from the point of view purely technological. This is how this rejecting attitude appears. And this is not really the true preoccupation here, because we have this everyday improvement of people's life that is in the core of the question. Lise, it makes you react, actually, what has just been said. Yes, indeed. And I think that paradoxically, we have, how can I explain all of this? The paradoxical effect of the post-COVID crisis, because we have already seen that innovation can basically help us a lot during the crisis. And I think that we had this important rebound, collective rebound, especially for the prevention, and this is something that illustrates this perfectly. So I think that's why we are here as well. And I believe that what will allow us to deal with this rejecting attitude is the collective approach. And I think that events like CHAM will also allow us to somehow refocus on all of the collective objectives and to share our strategy and vision. And I think that we can all agree on the fact that innovation, especially technological innovation with artificial intelligence, but also the need of having a regulated framework. We have this act, we're very attentive to all of this because we have been talking about the innovation in terms of drugs and medicines and products related to health and safety and so on. So I think that it's our responsibility to have this administrative process that will be like a safeguard, a guarantee of including all of these topics, but also have this simplification and agility that will be here, so that to allow us to not remain in the status quo, but to allow the innovation to develop And this is the mission of the agency, with this will of having the prospective approach, so really having this vision and the capacity of anticipating the innovations in order to better prepare ourselves on the organizational and financial plan, but also have this capacity to do the follow-up for the projects by anticipating the requests of the health authorities, because they need to do regulations, but evaluations and assessments as well, because we need the technologies and innovations that will be safe and innovative and performant, but also agility and the acceleration of the process, so that between the research and the access to the market, we will be able to progress faster and faster, at least at the rhythm of the development of the innovations, because we can see that the innovations today are the results of the research that started 20 years ago, so we have to work faster. So if we're talking the innovation today and the examples, Olivier, you have been talking about the teleconsultation, and this is the topic that you really know very well. And I think that this is a very tangible example of the technological evolution and innovation, because we had before COVID, after COVID, during COVID, and this is something that changed a lot our system. So the access to the care of our patients and also some free time for the doctors. So when we're talking about teleconsultation, because this is also part of the topic this year, can we also talk about the improvement of the care for the patient? Yes, indeed. This is the topic that is very dear to us, and I will be probably talking a lot about this, probably with Qare. Well, we are the leader of the teleconsultations in France, and up to now we were able to do over 4 million teleconsultations. We're working with liberal doctors and also the doctors that are employees. We're doing 1/3 for general treatments and 1/3 for specialized treatments. We're doing for dermatologists, gynecologists, and therapeutics, and we have 10% of our activity that is dedicated to the health, mental health. That's also another important topic, and the overweight will also become another topic. Just as you have underlined it, the advantage of the teleconsultation is to adopt, but also we have to think about everything that will come further, and we are thinking about all of this, and this is very, very important. So it actually facilitates the access to the care, because it allows the patients to have the access to the doctors when they are in the situation where they cannot go and see the doctor. And I think that the minister has yesterday talked about the COVID crisis, that we had to make some doctors from Bordeaux travel to Paris. So that's the same principle here. And we also have at Qare 31% that are also general practitioners, and 37% that of our patients that are in a medical desert. So we actually need to facilitate the task for them, facilitate the access for them, and it also avoids all the useless transport and mobility, because if someone is contagious, go to the public transportation, that's probably not the best idea. So not all the patients really have the possibility to really go somewhere. So it actually also is an improvement here, but it also creates a lot of time for the doctor, additional time. So yes, it actually creates some medical time, because, well, the consultations, teleconsultations are more time effective than a physical consultation. This is not the case, I would say, because a teleconsultation, whenever it is done in a right way, and it should be done in the right way, will have the same length as the consultation, physical consultation on site. So it's not how we create some additional time for the doctor, but throughout the flexibility and the comfort of the practice, we will be able to save time and to free some time for the practitioner. So it actually means that none of the physicians would like to stay in their office very, very late in the evening or on weekends. But here we can actually create this time for them and allow them to join this teleconsultation from wherever they want. So it will be something that will improve the productivity for the tasks that are not essential for the doctor. So this is the freeing of the medical time. This is about this aspect. At the same time, it helps the system because, well, for example, we are also integrating to the SAS. We would like to collaborate with SAS right now and to help them out. We have also written a lot and talked a lot on the fact that for the emergency services, it will be very logical. Like if we had at the very beginning, at the entry of the emergency services, this possibility to have teleconsultations in order to just guide people or just solve their problems, this will be a very good practice because in terms of execution, today it's still kind of complicated to go beyond the traditional framework. We have to work on it. But there are also some other points that we're working on, like trying to bring the patient closer to the doctor. Let's say we are experimenting with Qare right now with the nurses that will be going to see the patients at their home. So we will have this connected object and people will be coming and consulting in them if the patient cannot have this mobility. So we are doing it through Qare. And another thing that we are not mentioning very often is that the teleconsultation while going to see the patient directly allows to the nurse or the doctor to see the social and economic context of the patient. And that's very much appreciated not only by the psychiatrist, because when we see the context, we understand much more than whenever we see the patient in our office. So these are basic things, but we can actually conclude many very interesting things from here. We can also have some statistics because all of this is digital. So we have the logs. We also have all the traces that are here, all the follow-up that is available. So I will not go into the details because we will not be talking about everything that is said between the patient and the practitioner. But we can look at the statistics to see what was the length of the teleconsultation, what is the length of the synthesis that the doctor has provided, what were the motives of all of this. And this allows us at the medical level, at the level of the medical directorate, to deduce some things, to conclude some things, and to give some recommendations probably to the healthcare professionals. Yeah, so I actually last time also asked Thomas Fatom about the costs of the sick leave, and yesterday I have heard in the information that we are now relating the number of the sick leaves with the teleconsultations and trying to see how they match. So probably for you, you can see that there is a certain technological potential that can provide us with an answer to this problem of the sick leave. Well, for us, the sick leave is another topic, meaning that, yeah, we should, well, for us, for the patients that are doing the teleconsultations, well, they trust them, and the sick leave for more than 3 days for us is absolutely peanuts. Well, either it's authorized or not, for us, it doesn't make any difference. It will make a difference for the patients, especially for the mental health. Because, yes, it is true, as you know, a sick leave of over 3 days for teleconsultation without seeing the doctor physically, we are not really supportive of that. But then we also have some cases, like for mental health and things like that. This is kind of another issue during COVID, whether this is possible or not. But for us, it's not a really crucial topic. Andrea, innovation, is this the synonym of benefits for patients? Surely, but it's not as easy as that. In general, you have talked about it before that, and we have talked a lot about innovation today, but the risk is whenever we are pronouncing the word many times, we start losing a little bit the sense, the commitment, the values that are behind this notion of innovation. So what I have learned throughout these 2 days and through all of these comments, I'm very convinced that today we really are at this crossroads, because we have the innovation in terms of products, and that's what we can see. We have technologies and so on. Either it will be in the pharmaceutical or in digital or in telemedicine or in the diagnosis or in medical devices. We all know all of this. We know how to measure it, how to study it, the quality, the efficiency, the safety. We have all the international processes, national processes, European processes and agencies that are dedicated to all of this. But when we look at the innovation of the processes, and that's what I've learned during these 2 days. Well, for me, this was a concept, well, I will not really say that it's like a dark concept, that the one that is in the darkest, but it's a little bit difficult to really understand all of this. And the link between the two is also difficult to understand, because the innovation in the products can be absolutely fantastic. It can bring a lot of benefits for the patients, but then it's for us also to take our place. Yeah, well, if you talk to us about the bicycles, because you have this absolutely wonderful metaphor, yeah, well, hopefully everyone understands my accent because I grew up in Rome. When I'm thinking about innovation, it's very easy, because I'm thinking about the best bicycle in the world. Just imagine this bike that will be of 50 grams of weight, and it changes the speed just as you think about it, or probably you just touch it. And then you put it at the very middle of the traffic in Rome at midday. So that's it. Never, ever, it will give you all of this full performance, and you will never be able to use all of its benefits. So you take the innovation, just as I know it, the cardiovascular and all the different things that exist here. So in what type of hospitals are you going to put all of these absolutely fantastic, innovative products? And especially, tell me, if we cannot somehow match both sides of this issue, we will stay, and just as Laurence has already said it, we will be staying in the silos. We will stay in this budgetary fragmentation that does not help us to understand the impact, the transformative impact of some innovations. And this example of the bicycle is probably a weird example, and sorry for that. But finally, at the end, it boils down to that. We have this innovation of the medical technology in the hospital, and you would like to, let's say, diminish the length of the stay and avoid intensive care. But the person will say, so what do I do with this bed? What do I do with this intensive care sector? Can I treat someone who has cancer or something else? So, you know, all of these questions arise. And here, the organizational aspect plays and becomes fundamental. So we really need someone who will be creating a framework for all of this and to translate all of this into an investment and the budgetary management, I would say. Lise, in the healthcare, we understand that everything is absolutely amplified because we are dealing with the fundamentals of life. We have heard the testimonials of the witnesses in Switzerland and in France, because we're talking about life, pain, death, and things like that. So at least that's how I see it. So the innovation in medicines and drugs is most regulated and controlled of all the innovative processes. And you are in charge of an organization that provides the driving force of all of this. So how can you provide the solutions that are concrete solutions, tangible solutions today? Well, that's a very good question. It's almost a philosophical question, I would say. And it actually reminds me also, how would I say that, a framework that has been offered to us by Nicolas last week. So how can the innovation go beyond borders? So it's pretty much the same topic, I would say, for me. So, of course, the challenge here is to have this global and systemic approach, to look broadly, and an interministerial approach as well, because our Agency of Health has this particularity that we are a structure that is in Matignon, but we also have very important connections with the industry, the research, and the health. And this is the element that has that looks a little bit administrative, but that's very important because today, more than ever, we have to have these bridges and connections. We have to forge all of them. We have to connect all the different stakeholders, whether the stakeholders from the research, from the care, from the industry, from the innovation, and so on, so that everyone will work together to ensure this continuum, as you were saying it, so that to make sure that the innovation will go from the fundamental research to the bed of the patient, to the healthcare professional and the healthcare services. So that's the goal of the innovation on one hand. And you were talking about these hospital beds. So obviously, if we don't have this prospective vision and the capacity of anticipating the arrival of the innovations, because we understand that there are some organizational impacts here that will not be modified from one day to another, because we need some time for that. We need some time to give the time to the healthcare establishments and to the establishments of the city to adapt to all of this. So the first point, we are working on the mechanism that is unified, so the interministerial and all the agencies. Well, right now we are a small startup of the state startup. We have 15 people, so we cannot do it on our own, but we have to capitalize on the existing structures at the national and local level in order to allow this articulation. So this is the very first point for us. The second point for us is the acceleration of the processes, and here we are talking about the priority topics like the acceleration of the clinical research with the help of our sanitary agents and partners, clinical partners, because we need to accelerate all of this, because here we're talking about the innovation. We're also talking about the transfer of technology. That's what we are working on in order to accelerate the transfer of the research and passing all of it to the healthcare sector. We also are working with the technological experts and methodological experts in order to use all of this expertise for the new methodology of the clinical research, because here, once again, it cannot be a substitute to the classical techniques, but we can become much more flexible here and also make available all the new technologies and all the new methodologies in addition to what exists already. And we also are working on the dissemination of the innovation, meaning to connect the offer and the demand. So we have to look at the method and on all the possible leverage point for the public procurement. So we have some measures, some very tangible measures that are here in order to allow to all the stakeholders to connect. And finally, the very last point is, of course, the follow-up of the support of all the priority innovative projects like the French Tech and other tools that we have here are here to help all these projects to accelerate their development and to be disseminated also with respect to the plan Cause de Micron that is also here to help us mobilize all of this for the innovation in several priority sectors and areas like biomedicine and digitalization and so on. So this plan is a very important plan. So by listening to you, I would say that the priority and the main innovation that we would like to focus on is to allow, first of all, to all the systems and especially to all organizations to communicate among them. Do you agree, Laurence? Of course. Fully agree. I would also say that there is no technical transformation without digital transformation. So just to take a couple of examples. Well, I actually liked this example of the electric bike, very light electric bike. We have already talked a little bit about it. If we don't have a plug to plug this bike, well, the electricity will not serve to anything. And we already have this problem. Sometimes we have not a good infrastructure and no Wi-Fi in all of the operating units. So also we have to make sure that thanks to all of these innovations, we will be able to help different organizations on building this healthcare journey. Because when we are talking about the technological innovation in general terms of healthcare, we will have this new packs that will also be valid for all of our competitors. We will have the new X-rays and things like that. But we're here mostly working with people who are scientists. So it's not something that is very complicated, but now it will also allow us to have a better diagnosis. But, well, diagnosis, we actually have to do it once, not 2 to 3 times, because unfortunately for a lot of patients, this is still the case. They have to undergo it 2 to 3 times. But there can be also some other innovations that are much more difficult to implement. We are talking about very big equipment, but we will have tools here that will allow us to monitor better the patients. Let's say in the intensive care, we have to have this very good structure and good Wi-Fi, but we will probably be able to postpone all of this monitoring, not postpone, but move it to the services, I would say, because here, well, it becomes kind of complicated because we don't really have a habit of all of this. Very often we don't have the Wi-Fi, and then we have to have this change management, the right tools, the right budget. How can we tell ourselves that what we will save here, because yes, we are monitoring patients a lot in reality, but the patients die, especially when they're in their rooms. So here we're coming to the change of the mindset. That's when it becomes very, very difficult. But this is also something that participates a lot in the evolution of the healthcare journey. In addition to what Lise was saying, it's important for us to put together everything between the clinical and the research area. We are also working here, and we have gone to Nice to see all the teams from there on a project that are that are doing the research, but also looking at the healthcare journey. So how can we make them participate? How can we make them participate in there? How can we work with different teams from the very beginning in order to make sure that these programs are very well built? And where will it bring us? Until what point are we going to advance in the healthcare journey? Will this be at the level of the territory and so on? How can we explore all of this? And then at the same time, we have all this IT part, because we have talked about the healthcare, but we also have this organizational part. And in this country, we have a real problem here because we have a lot of problems with digital and with data. What are we using in terms of data? For the diagnosis, we start using cockpits right now, and we have had this example of a plane. So who would like to go on a plane, on board of a plane where there is no real pilot? So in here we are starting evolving quite well with the cockpits, but right now we are almost the only country in the world that does not have this common center. So how can we make sure that the data, all the data that exists, is connected so that we will be able to input it into the organization? There are some very simple things to do, and not just by the change of management, but throughout the tools. We just have to make sure that all of this communicates and how can we communicate among it, I would say, and also for the hospitals, because the clinical part is quite logical, but how can we do this change management starting from the data that is connected among it in order to transform our healthcare systems? So you're saying that in our country we have some problems with digital. Marc, we have already talked a lot about the differences of care in France and in other countries, and you know Germany quite well. For you at Roche, is France still a very interesting playground? I would say that there is something in this very beautiful country, like the mountain. Well, there are innovations that are coming, but they are coming a little bit later. A little bit late. Yeah, this is what I have already heard just before that. So we will be able, hopefully, to bring down this delays. So how can we guarantee that the access to the solutions that are available today will come faster? And I would really like to go back to the two elements that have been announced by Olivier, but also by Laurence. And I would also like to add to the teleconsultation, telediagnosis, and Laurence, I agree completely with you, is the overall data, all of the data, the holistic approach to the data will allow us to look at a patient from another angle than what we do today. And the access of the patient to all of the solutions is also a crucial point. So today we have all the tools. If we are looking at the availability of the algorithms at Roche, we are looking at the clinical studies that we have carried out 20 years ago with the algorithms today. We discover some things that we were not able to discover back then. So you see what I mean here? Now, we are working here at the international level, so this is not just the Germany unit or France unit. So this is really an exchange of all the know-how. So the tools are here, they are available. So how will we use these tools in an efficient way? Marc, you are online with us and you are a sociologist. So probably if we look at it a little bit from above, we understand that the society is not really asking the innovation, but they are asking for progress. And we have some points that are very clear here, especially at the organizational level. But concretely, for the studies that you are carrying out, what are our fellow citizens expecting for us? A future that will be more reassuring, or I don't know. Well, I would say that today we're talking a lot about innovation because this is something that, like introducing something new, because new tax is also an innovation. So people would like to have some progress because they would like to have not new, but better. They want to have less pain, social progress, medical progress. They want for it to be cheaper. So the four fundamental things, one is to simplify life, two, to be accessible to most, so three, to improve the relationship between people, to last longer, and to improve the everyday life. So this is very classical. So people would like to be happier or feel better. We cannot really accuse them of wanting that, because it's always a little bit difficult for us. For the innovation is that we do not often see directly the impact on the progress. And another key aspect here is that we have talked about this mistrust in the science, and that's very worrying for us, because we also measure the very important work that is done here for the acceptance of the scientific discourse. And we have the media that says that scientific opinion is an opinion just as another, just as any other. So I think that that's kind of shocking. And, well, the opinions of the scientists today, this is the science of today. So you cannot really say that. So we are underestimating the very long-lasting impact of a lot of things. So if we do not treat this topic openly very quickly, then we understand that, yes, indeed, errors are human. So this relationship to the science and this attitude toward the science with the Academy of Pharmacy, the Academy of Science, the Academy of Medicine and Technology, and so on, you create this report and it will be downloaded 250 times, and then you will have someone online that will be talking about the chloride of sodium and telling you that this is the best medicine or things like that. So that's our context right now. So we need a much more educative, pedagogical approach for all of this. source for all of this data. So I think that the better insertion into the society, to better communicate, we have to listen to the society, because we are criticizing the communication for the scientists from the scientific side and from the medicine. We say that this is very authoritative, very arrogant, and it's like introduction, prohibition and authorization and regulation, and there is not enough of discussions and exchange, and we are not talking enough about ethics, about individual data and about individual sides. So I think that there is a lot to do here, because yes, indeed, we can criticize and say that the society gets it wrong and things like that, but the communication did not really evolve with respect to this new context. It should be a little bit more empathic, more holistic, more educative, not just talking about the technological side, because very, very quickly medical and scientific can go to this language that is not understandable to everyone else. So I'm really sorry that I have probably pushed too much on this aspect, but this is something that we can see on all the analysis. So less arrogancy and much more pedagogical approach. Do you agree with this? I would say more actions also. If you allow me, I would like to say there was just one word that was used a lot after innovation, you know, when you just create this word cloud. So this was also the word reflection. So when we have a problem, we start thinking about it. So there is this reflection. That's very good, but later on we have to act. Today, in all European countries, and not exclusively in France, you see the problems of almost lack of medical staff in the hospitals. We have innovation that can reduce the impact and facilitate the situation here, but we cannot really approach all of this with a true reflection that will not remain just theory, or it is very good to have these plans for 10 to 20 years. We are looking toward the future, but we also have to look at the present. So what am I doing wrong today? And there is all of this innovation that is available in the countries, but we also have to activate learning by doing, as it is said in English. So we are also learning at a certain point by doing things, by introducing the processes, because when we are sitting here and waiting for an ideal process, then probably we are not giving to the citizens what they would like to have and what we should give them. Well, in reality, this is one of these approaches that you are mentioning, so we cannot really take the time to define the perfect organization before starting to act. Yeah, I actually like very much this word, action and courage. That's what I would like to add to all of this. That's an absolutely fantastic transition for the topic that is related to the funding. Well, sometimes this is the topic that is making people angry, but this is not without surprise. So either for the authorities, for the patients, or the private investors, it's important to finance the innovation. So Olivier, I would like to ask this question to you, because hundreds of millions have been invested over the last few years into the teleconsultations. We know that financing is a determining factor, and I know there are barriers. So what are the barriers and the challenges in terms of the financing? Because we understand that you have some priorities at the level of the agency as well. Yeah, well, this is an important challenge as well. So in terms of teleconsultation, the economic model and the economic equation is not found yet. So the margins are very, very small, and all the actors of the teleconsultation for years and years are consuming, are losing, investing a lot of money, and all of this can be like tens of millions in France for the last year, and probably hundreds of millions if we take a bigger period. So I'm not really in favor of asking for some funding to my colleagues, because they will say that I'm crazy. But for me, it's important to create an activity that will be economically healthy, that will create some value, and that will be paid by the system or patients or doctors, or I don't know. But today the equation is very complicated for everyone. We decided to introduce what we call the service fees, which are the additional fees for the care, for the fees related to the care, to the treatment, because in France the prices for the treatment are regulated and is very often free, but the access to the treatment is not always free, because if you take your car to go to the hospital, you will definitely use some oil and things like that. So we also need to finance our innovation. Yesterday we have talked about this tool that is called POSOS, and this is an integrated solution for us. Well, we are still discussing the prices, but it is possible for us to integrate the teleconsultation and their prescriptions. Well, of course, all of this costs money, and this money for now is not really paid by the public authorities, but that's not very important because we need to find some sources of revenue so that to finance this innovation and make sure that it continues existing. I think that there are worse situations in the sense that in France we have the programs of the promotion of innovation in France. It's much more tangible today because, well, you have talked about this startups, and I actually love this concept, of course, but at the same time, we would like to finance all of this with a budget that is done in a silo, an envelope, budgetary envelope that was designed 20 years ago. And that's an internal contradiction that we have here, because once again, the innovation of the product, but the innovation of the process also must be here. You cannot finance something that DGOS or hospitals would say, oh, but no, I have my budgetary envelope that the economical committee of the healthcare products have created with me, and I have my ministerial letter that tells me to do this and this with my budget. So everyone is basically looking at their own business, and we cannot really break all of these barriers of the silos and say that this investment will go here. OECD in 2017, before COVID, they actually did this European average, and they found out that 23–24% of all of the expenditure of the hospitals is wasted, meaning that it's €1 out of 4 approximately. So that's really huge. Well, I think that this is something that makes you react. Yes, indeed, this is something that is aligned to all of our priorities. I think that there are many different angles to answer this. I think that first of all, for 2030, so this is the pilot for the vertical health, and well, of course, this is not answer to all of this, but we call it a lever for the pluriannual financement. We have talked a lot about the annual financement and how many problems it represents, and I think that today, for this plan for the innovation of health in 2030 in France, it actually is oriented at many different pillars, and we have here a major financement for the policies of ambitious sides that has really this focus on the national territory, not just in Paris, but to connect the research upstream, the healthcare, the clinicians, but also the scientists, the startups, and the entrepreneurs, to give this capacity on the site to have the interdisciplinary approach. So that's the very first point, and we are lucky to have it. We also have the financement to have the biobanks and cohorts in order to attract some researchers. So the goal here is to really have the structure and valorization for all the data, and this is something that is financed for 2030. So I think that this is like oxygen that is arriving here, transversal and pluriannual, and we are also hoping, and the Minister of Health has talked about it yesterday, to go even further with France 2030 and have some very ambitious projects in terms of prevention as well, so we can really dream in this sense. I think that it will be very well for us to have some projects that will allow us to have a much more transversal vision than what we have today with this anchoring, territorial anchoring, and the capacity of working with regions. So this is something that we will really support very strongly. And there is also another point here that is, well, it has already been mentioned by the participants a little bit before, is that we actually have to make the framework evolve. Regulatory, but also financement-related framework must evolve. And I think we already have different mechanisms for the innovation, for the access to the innovation, but this is not perfect. It has to evolve. Nonetheless, in France, it is actually a very efficient lever, and I think that we can go even further with that, and this is part of the topics that we're working on with the different teams of Emission Santé and our partners between in the ministry, because we're trying to go even further here for the budget and so on, and Roche is doing diagnosis here. So we would like to go even further with the tools, medical tools, and all the different procedures, preventive as well as therapeutic, in order to really be able to provide the best results with what exists here, because we can do something without inventing things that will be very complicated, but we actually need to grant this early access to the innovation, especially if the innovation is considered as being interesting by the healthcare authorities, and by their dissemination that will be controlled once again, not anarchic and chaotic, but controlled. Also allow this evaluation and evolution in order to really feed into the innovation that will be done later on, so that all the treatment will be done to the right patient at the right time and at the right moment. So just to conclude, we already have some mechanisms that exist and that are globally very interesting, but we can go even further and improve even more here. And our goal here is to really use this lever that we have with France 2030 and with everything that it offers us. Marc? So if I would like to react to what Lise has said, I would like to say that here in France, I have learned that there is this diagonal emptiness, meaning that we also have some medical deserts. And right here, the diagnostic innovation can bring us something, give us something through what we call the delocalized medical biology, meaning that here in France, in the public sector as well as in the public sector, it is quite known that the diagnosis is done through this very centralized big medical centers. But what happens in these medical deserts, in these rural areas where people don't really have the means, I would say? And here, from the diagnosis point of view, we have the tools that are available. So the question is, how can we use and value these tools so that the industrials would also want to continue working in this area? Yeah, just a reaction. The diagnosis is the fundamental point, but we cannot forget that we have to work downstream as well, because for the patients that cannot get care is very counterproductive. But we don't have to forget, I'm here thinking about the digital innovation like telesurveillance or some other tools and mental health. Very often we are asking ourselves, so what does the solution do to us with respect to the ideal care? Well, the ideal care does no longer exist because we don't have these caregivers and we don't have this availability of care that is here. So this is why it's probably sometimes very important to have this pragmatic point of view, because the ideal situation is not here. So how can we have this care that will be as adapted as possible to the real concept and context of the French people? Well, pragmatic approach. Before giving the floor to Laurence for the conclusion, I know that, Olivier, you have a couple of elements that you wanted to share with us. Yeah, I have been talking about all the good of the teleconsultation. Well, of course, the teleconsultation right now remains very basic. And this is what I call the teleconsultation 1.0. For us, it's very interesting to work on the 2.0 version. So how can we enrich it so that it will be more qualitative, more useful, and so on? So we have these two important topics here. Well, probably even more, but the two are major here. The first one is to make this teleconsultation that will be augmented teleconsultation that will somehow improve the quality of information and the exchange, the conversation of the patient and the doctor, and also the help for the decision of the healthcare professional. But starting from today, let's say, if we take the smartphone, well, I take my smartphone here. This is my iPhone 8 because I'm using 8 instead of 15, and this is my contribution to the ecology. So today, you already have tools that are absolutely incredible mechanisms and devices, medical devices that will allow you through teleconsultation to really look at the cardio rate and the rate of breathing and the evolution of the breathing of the person. So these are the information that can be transmitted to the healthcare professional. And you also have some connected devices that right now are very small and easy to use. Well, I have this one with me today, but there are some others as well. This one is much smaller than a regular something that you will be regularly carrying with you. And here you have the stethoscope, and you can basically, through this, transmit the data to the doctor. You have the HD camera and different other tools that will be very interesting for transmitting some additional information to the doctor. And I think that this is really easy to buy and not very expensive for everyone who is right here, but probably not for everyone in France, for all the households. But this is something that will enrich the quality of the teleconsultations. But there is also the other field, the other area, which is the help to the decision of the healthcare professional, because we understand that the healthcare professional, sometimes they will need some help for the decision. And here they will have also some additional tools like help for the prescription, help for the diagnosis, help for the follow-up, for the monitoring and surveillance between the two consultations. Also, the the artificial intelligence. So we have all of these tools that we can talk about today that already exist. Well, at least one part of it exists. The other part probably not yet. But today in teleconsulting, we cannot really listen to what is said between the patient and the doctor because there is this medical secret. But the artificial intelligence can listen to all of this, and it can provide a synthesis of all of this. And this artificial intelligence that will not break the medical secret can also give a suggestion to the practitioner, whether, let's say, did you ask this question or did you think about that? It's not like replacing the general practitioner, but enriching their practice with new tools so that the teleconsultation wouldn't be, well, because today it's still like plan B, so we're doing teleconsultation as plan B, plan C, because we cannot do plan A. What I'm saying to the teams when I need to encourage them, we have to work on the quality of the innovation and enriching of the teleconsultation so that it becomes as good as plan A. So it will not replace the general practitioner or the family doctor, but we can enrich it and make it much more than what it is today. So it's algorithms and things like that, and we're working on it. Laurence, we will find each other once again here in CHAM 12 months later. So you have this responsibility to formulate your wishes for this 12 upcoming months. What do we wish to one another? What do we promise one another? So I have this intimate conviction there will not be a transformation of the healthcare system without innovation, all the innovations that we have mentioned. All of this goes through dialogue, trust and courage of all of the stakeholders, including the politicians and the industrials that are the real actors of the healthcare. And the reciprocity is true here. So I think after having listened to them, we have to work all together in order to participate in the transformation of the healthcare system through the innovation, because there are much more risks in not doing it than in doing it. So the 12 next months are basically under the theme of courage. Yes, indeed. So thank you very much for this roundtable. I think that we have finished 4 minutes earlier, just as Guy has asked us, because we have this final message of the Minister in charge of Industry.